Hello doctors. In the first video of pharmacology revision videos, we are going to talk about introduction of parasympathetic nervous system. So we are going to divide this introductory part of parasympathetic nervous system in three parts. The first part will be about origin, and the second part is about how action potential travels through synapses using neurotransmitter and related drugs, and third part is about receptors of parasympathetic nervous system. So let's get started. As we can see in the diagram, there are 5 parts: cranial part, cervical part, thoracic part, lumbar part, and sacral part. So parasympathetic nervous system includes 4 cranial nerves, which are cranial nerve 3, 7, 9 and 10, and from the sacral part it includes 3 segments: segment S2, S3 and S4. Here we can see the nerves of parasympathetic nervous system is mainly originating from the cranial part and sacral part. So the origin of parasympathetic nervous system so called craniosacral origin. Let's come to the sympathetic nervous system. It derives its origin from T1 to L2 segments of the spinal cord. The origin of sympathetic nervous system is mainly from thoracic part and lumbar part, so origin is called thoracolumbar origin. Now let's see the general outlay of sympathetic and parasympathetic nervous system. There are 3 main structures in both parasympathetic and sympathetic nervous system. The middle one is ganglion, the preganglionic neuron and postganglionic neuron. As you can see, I denoted the ganglion by letter N. It shows that the universal receptors of the ganglions are nicotinic receptors. In both sympathetic nervous system and parasympathetic nervous system, the neurotransmitter of preganglionic neuron are same, which is acetylcholine, but neurotransmitter of postganglionic neurons are different. In parasympathetic nervous system, the neurotransmitter of postganglionic neuron is acetylcholine, but in sympathetic nervous system, the neurotransmitter of postganglionic neuron is norepinephrine. There are 2 exceptions in sympathetic nervous system. The first one is in adrenal and sweat glands, where the neurotransmitter is acetylcholine, but the action of this neurotransmitter is sympathetic. And the second is dopamine, which is present in renal blood vessels, which causes vasodilation and it leads to diuresis. Now let's come to the second part. Here we will see how action potential from one neuron to another neuron is propagated and eventually to the organ with the help of neurotransmitter. Now let's take this synapse here and we'll see how it works. Here you can see the structures like presynaptic membrane and postsynaptic membrane. The space between these membranes so called synaptic cleft. Before looking at how action potential is propagated, we will see how acetylcholine, which is a neurotransmitter, is synthesized and stored in the neuron. Here we can see in the diagram acetyl-CoA, which is synthesized in the mitochondria of neuron, plus choline, which is taken by the systemic circulation with the help of enzyme called choline acetyl transferase. This together forms the acetylcholine, which eventually packed in the vesicles and stored in the neurons. When action potential is propagated to the presynaptic membrane, it depolarizes the presynaptic membrane, which leads to the voltage-gated calcium channels to open, and there is an influx of calcium ions, as we can see here in the diagram. This calcium fuses with the vesicles, which helps in the fusion of vesicles to the presynaptic membrane, and eventually there is the release of acetylcholine in the synaptic cleft. Now here on the postsynaptic membrane we can see the nicotinic receptors are present, which I drawn in green color. The acetylcholine, which is released from presynaptic membrane in the synaptic cleft, comes and binds to these receptors called nicotinic receptors, which are sodium ion channel receptors, which causes opening of sodium channels and influx of sodium in the postsynaptic membrane, which leads to the depolarization of postsynaptic membrane, and the action potential is generated, which is eventually propagated to the organ. Now here you can see the structure in green color, which is the structure of acetylcholine esterase enzyme, which is present in synaptic cleft. Then what's the function of this acetylcholine esterase? We will see now. Before looking at its function, we will see its structure. So it contains two sites. The first site is stereotic site and second site is anionic site, means negative site. The acetyl and choline of the acetylcholine neurotransmitter is connected through the special bond which is known as steric bond. Acetylcholine released in the synaptic cleft, which is taken by acetylcholine esterase. The choline part of acetylcholine is positively charged, so it binds to the anionic site of the acetylcholine esterase, and stereotic site leads to the breakdown of steric bond between acetyl and choline, which eventually separates the acetate and choline. This choline eventually taken back into the synapse, which is called choline reuptake. This step is also known as rate limiting step. This is how excessive neurotransmitter in the synaptic cleft is metabolized through the enzyme. Now we will see the different drugs which limit the propagation of action potential by its action. So first drug is vesamicol, which inhibit the entry of acetylcholine in the vesicle. So there will be no release of acetylcholine in synaptic cleft and there will be no propagation of action potential. Next drugs are botulinum toxin and beta bungarotoxin, which inhibit the release of acetylcholine from presynaptic membrane to the synaptic cleft. Botulinum toxin, which leads to the disease known as botulism. The Botox, which causes the muscle relaxation, it also has some uses, like it can be used in dystonia, dyskinesia, migraine prophylaxis, achalasia cardia, and in cosmetology. Next drug is aminoglycosides, which inhibits the voltage-gated calcium channels. So there will be no influx of calcium and there will be no release of acetylcholine. And the last drug is hemicolinum, which inhibits the choline reuptake in the presynaptic membrane, which leads to the decline in synthesis of acetylcholine. Thus, we ruled out how action potential is propagated through synapses from one neuron to next neuron and eventually to the organ. Now let's come to the third part. Here we will see receptors of the parasympathetic nervous system, which is divided into two. The first is nicotinic receptors, which are sodium ion channel receptors, and second is muscarinic receptors, which are GPCR receptors, means G protein coupled receptors. There are two types of nicotinic receptors. The first one is NN type of neuronal type of nicotinic receptor, and second one is muscular type of nicotinic receptors. The neuronal type of nicotinic receptors present in central nervous system, ganglion and adrenals, and the muscular type of nicotinic receptors present in neuromuscular junction. Overstimulation of neuronal nicotinic receptors in central nervous system causes the excitation or seizures in central nervous system. So the seizures are main symptom in nicotinic poisoning. Stimulation of adrenal medulla by neuronal nicotinic receptor leads to the release of norepinephrine from the adrenal medulla, which is eventually converted to epinephrine with the help of cortisol and released in the plasma. Overstimulation of these adrenals can lead to the increased level of epinephrine in plasma. Now let's come to the muscarinic receptors, which are divided into 5 types of muscarinic receptors, which are M1, M3, M5, M2 and M4. The purpose of writing these receptors in such order is that the first 3 receptors M1, M3 and M5 are GQ subtype of receptors, and the last 2 are M2 and M4 are GI subtype of receptors. So what's the GQ and GI subtype of receptors? So GQ, which causes the increase in cyclic AMP, which leads to the increase in level of calcium and which helps in contraction, and GI subtype of receptor, I means inhibitory, which causes the decrease in cyclic AMP and decreased level of calcium. Also there is a opening of potassium channels which leads to the relaxation. So GQ type of receptors are mainly contractile and GI subtype of receptors are related to the relaxation. Now let's come to the receptors. The M1 receptor is present in central nervous system and GIT. In central nervous system, the stimulation of this receptor will increase the cognition. Taclifensin is the drug which is M1 agonist, which can be used in Alzheimer's disease, which leads to the cognition. The next receptor M3, it is present in GIT, salivary glands, bronchi, bladder, circular muscles of iris and blood vessels. So overstimulation of this M3 receptor in GIT can cause cramps in GIT. Also overstimulation can lead to the increased secretions from salivary glands, bronchoconstriction, overactive bladder, meiosis, but in blood vessels it causes vasodilation. So M3 receptor in blood vessels present in endothelial cells and also in smooth muscles. So endothelial cells, by the releasing of nitric oxide, causing the vasodilation, and M3 receptor in smooth muscle causes vasoconstriction, but the vasodilation process in vessels are dominant over the vasoconstriction. So the M3 stimulation causes mainly vasodilation. So next receptors M5 and M4 receptors are mostly present in central nervous system, but there is no any clinical significance of these receptors. So now we will go to the M2 receptor, which is mainly present in heart, in SA node and AV node. So M2 type of receptor is GI subtype of receptor, which is inhibitory. So in SI node, which inhibits the SI node, which leads to the decrease in heart rate, and in AV node it can lead to the AV blockade. The overstimulation can lead to the AV blockage. So guys, thanks for watching this video, and I hope this video is informative. Please like, share, comment and subscribe to my channel, and stay tuned for next video.